Well, after I decided that being an astronaut and a supermodel probably were not in my cards, I probably really have been interested in being a doctor for as long as I can remember. I'm Dr. Christina Richards at the Surgical Weight Loss Center of Utah. I've been a bariatric surgeon for about 8 years now. And am really excited to make such huge life changes for patients, getting rid of medical comorbidities and giving them a life they never thought they were going to be able to have again. So I started out actually as an exercise physiologist at Ohio State University, and then got kind of bored doing that and said, well, I think I want to go to medical school, so went to medical school at Ohio State. Then I did my general surgery residency at the Medical College of Wisconsin in Milwaukee. I kind of got interested in doing laparoscopy there and was actually awarded as a chief resident laparoendoscopic surgeon of the year or something like that. And so decided to go on and do advanced training in laparoscopy. Went on to do a laparoscopic fellowship at the University of Washington, and then came back to Utah, which is where I grew up, to practice. I then actually adopted 2 children as a single person, thinking I would probably never get married, and then a wonderful man came along and we got married last summer. So now I've got my little family, kind of backwards, but I figured it out somehow. When I started in practice, bariatric surgery was probably the last thing that I wanted to do. I had seen some really serious complications in my residency, and I had felt like the patients didn't get a lot of support that they probably needed. I then had a patient who came to me and convinced me that I should start doing lap bands, and she wanted me to do it for her.
She's a very caring, loving, professional doctor who wants to be successful by having you be successful. There's no better definition of an excellent surgeon than that.
I then learned how to do that and said if I was going to do that, I was going to set up a program involving the hospital and a complete multidisciplinary program. And then it's evolved since then. I decided we wanted to start doing gastric bypasses and ultimately sleeves. Dr. Cottom came and brought in a lot of expertise from his side, and it's really just kind of grown from there.
I've been in practice with Dr. Richards ever since I've come to Salt Lake City. We perform bariatric surgery together, and I can tell you that I've had partners as I've moved around the country, and she's the best partner I've ever had. She is very empathetic with her patients, strives to obtain the best, and is generally an all-around good person.
It is such a gratifying feeling. There is very little in medicine where you can actually reverse diseases and have them go away. That's part of what attracted me to surgery in the first place, and bariatrics is even an extreme of that. It is just amazing to see people get in completely new lives, have 20 years extra to live, and to really live it to its fullest. It's been tremendous.